Well, welcome everybody. My name is Rosie Gomez, and I want to thank you for taking the time to be with us today, both in the room and virtually. The issue of human trafficking is one that we have to address by understanding different perspectives. So I'm really excited that we have a great panel today that will make us think a little deeper about this issue and how to address vulnerable youth. And I'm very pleased that we have our moderator, Catherine Chan, who is the director of the Office on Trafficking in Persons, to moderate this panel.
Thank you very much, Rosie. And thank you for those in the room joining us this afternoon for this master session, and partners out in the field who are joining us via live stream. It is a pleasure for me to be moderating this panel of very distinguished experts in the field, working many years serving victims and survivors of human trafficking and working on critical prevention efforts as well. The purpose of the master session today is to not only explore the issue of child trafficking, but particularly to get perspectives on how various professional sectors and systems of care are confronting the issue of trafficking, are impacted by the issue of trafficking as well, and particularly to understand how survivors are encountering different systems of care. During the master session, we will provide perspectives from the child welfare perspective, runaway homeless youth, court, healthcare, and from the perspective of survivors of human trafficking. To start off with, I just want to give a little bit of background on how the Department of Health and Human Services is addressing the issue of human trafficking. The conference here is put together by the Children's Bureau. We have partners within the Family and Youth Services Bureau, primarily working with runaway homeless youth. At the Office on Trafficking in Persons, we are working to coordinate across the Administration for Children and Families, including working with our partners in the Administration for Native Americans and many other systems of care addressing human service needs. But we're also working with our partners across the Department of Health and Human Services, because we see human trafficking not just as a violent crime issue, a child abuse issue, but it's also a public health issue, and we see it critical that we partner with public health and healthcare professionals. And then in addition to that, we are working with federal partners across multiple departments, including the Departments of Justice, Labor, State, the Department of Agriculture, Department of Education. And so we hope that what you'll see presented on the panel today is how these multiple systems that we work on at the federal level make themselves real at the local level, where there's very real traction day to day. So with that, I want to introduce, or the panelists will self-introduce and give a little bit of their background. And in addition to their particular perspective working with victims of trafficking, each panelist will start off by sharing one key lesson that they've learned over the years working with survivors of trafficking and working on the issue of human trafficking. So first, we'll just go straight down and starting with Judge Puig Lugo. Thank you.
Thank you. Good afternoon, everyone. My name is Hiram Puig Lugo. I'm the presiding judge of the Family Court of the Superior Court of the District of Columbia. I have chaired, going on 5 years now, a working group focusing on our systemic response to youth who have been commercially sex trafficked. The one thing that I have learned through that work is that children who have been trafficked present a complicated and serious set of conditions. It is impossible for one sector to address each and every one of those needs, and collaboration across sectors is absolutely essential if we're going to give them the support that they need.
Hi, I'm Dr. Catherine Dye. I'm a child abuse pediatrician at Children's National Medical Center in DC and Inova Fairfax Hospital. I perform the comprehensive forensic medical evaluations of youth who have disclosed being trafficked or who are suspected of having been trafficked. I echo Judge Puig-Lugo. What I've learned is that it's really important to work with our community and agency partners, and that these youth need very comprehensive medical evaluations. Sometimes they take me 2 to 3 hours to begin to address all of the immediate and sort of long-term health consequences of what they've experienced.
Good afternoon. I'm Tammy Sneed. I'm the Director of Gender Responsive Adolescent Services for DCF in Connecticut. In my role, I also co-chair the Governor's Task Force on Justice for Abused Children and our Human Anti-Trafficking Response Team we call HEART. We've been focused on this issue since about 2008. We've learned lots of lessons, but echoing what the judge started with, we've learned very quickly, actually probably not as quickly as I think we should have, is we can't do this alone. We need to have our community partners, our law enforcement partners, hospitals, faith-based community, all participating, and we need the voices of our victims, our survivors, in looking at our system and developing our system.
My name is Diana Cisneros, and I'm with Preventing and Addressing Child Trafficking in California, and I'm a survivor consultant. I also have led groups for survivors for several years and done prevention education. And one thing that I think is important is definitely to have survivors at the plate when we're making decisions. It's so important to have a survivor there representing people, and they're going to know the gaps in your system, they're going to know where your weaknesses are, and they're going to be able to help give creative solutions to the problems.
Good afternoon. My name is Melissa Brocking. I'm the Director of Prevention and Wellness at Tumbleweed Center for Youth Development. We're a runaway and homeless youth provider along with a child welfare provider. And one of the things I do is I also run the Arizona Partnership to End Domestic Trafficking, which is a collaborative partnership that works with various service providers, training entities in our community across 2 counties to really address what all of my panelists have said, is that one entity cannot do it all, and so we really need to partner together. I think the one lesson that I've learned as we go forth is that we can't just talk about how we address the issue after it's happened. We also have to look at a preventative response and how we start to look within child welfare and our runaway homeless youth programs at the preventative response for our at-risk youth to make sure that they don't become prey to traffickers in our community.
Thank you. So as you can see, there are diverse perspectives at this, on this panel this afternoon, but then there are many other perspectives that we weren't able to fit in during this master session. So whether it's law enforcement, educators, the role of parents, and hopefully through our discussion and the question and answer period, everyone will get a sense of the other partners that will need to be at the table. But the diversity of the issue requires a diversity of response, and primarily what you'll probably hear based on the perspectives of the expert panelists this morning, some of the work and experiences serving survivors of child sex trafficking. But human trafficking is a very diverse issue, impacting not just children, but youth and adults, men and women, the LGBT population, American Indian, Alaska Native population, and it is a issue that manifests itself in the commercial sex industry through commercial sexual exploitation, but also in various forms of labor trafficking and labor exploitation. So we encourage you, as you listen to the discussion, the panelists, if you have questions on that full spectrum of trafficking, please consider raising those questions during the Q&A session. So to begin our discussion, I want to bring it over to Tammy Sneed from Connecticut. There's been a lot around in terms of federal legislation and new requirements for 4E agencies and child protective services to prevent human trafficking, identify victims, refer victims for services. And one of the main concerns that we come across at the Administration for Children and Families from child welfare professionals is a question of, how we already have such large caseloads. How can we take on even more work? Is this going to be costly? And given your work in Connecticut, could you share with us the model you have there and how you would address those types of concerns from peers in the child welfare system?
Certainly. We had some of those very concerns at the very beginning of our work, and every now and then we get a little anxious because we try something new and we're thinking it's going to give us more referrals and we're going to need more resources. And what we've learned is sometimes you just have to do it. And our approach in Connecticut, we have an amazing commissioner, is that these kids, even if they're not directly connected to the Department of Children and Families, they deserve our support and our services. It does not mean we need to take custody of these kids. We don't have to remove them from homes. What it does mean is that we're the clearinghouse for these cases. So in Connecticut, all trafficking-related cases come in through our care line. And any young person under the age of 18 that has any of those risk factors, we are going to respond to. Again, does not mean we're going to take them into custody. We were anxious at the beginning. We did have a number of referrals at the very beginning. They have grown over the years. The more trainings we do, the more referrals we get. But they have not been unmanageable. And when we look down deep into these cases, many of these cases really do need some support from child welfare. And we've had the gamut. We've had kids that are part of child welfare that are being victimized, and we've had kids that have no connections to child welfare being victimized. And we really have determined this is our responsibility. But as I shared earlier, it's not just about DCF. We're only one small player in this. And initially it was just us, DCF, responding to all these cases. And now we have a formalized team that does this work. We have what we call our Human Anti-Trafficking Response Team, known as HART, H-A-R-T. And that is a very large group of professionals, as well as community-based persons and faith-based communities that are meeting on a regular basis, talking about our system in Connecticut. We're talking about laws, we're talking about services, we're talking about interventions in the community. And then our system in each of our regions, and I often get asked from different states, some states have a regionally based system. We have a statewide system, but we do have regions, so each of our regions has a HART liaison. So our big HART team is looking at system issues, and our smaller HART teams are looking at cases and local resources. And we found that very, very effective. Until 2014, all of our work has been unfunded. So we have trained up and used our existing resources in Connecticut. In 2014, we got a grant from ACF, which has been a tremendous help. But prior to that, we were doing a lot of work in this area. We found some champions in the area. We did some training of trainers across the state. So it's not all dependent, again, on our child welfare professionals. So it's really about taking what you have, getting them ready to respond to these cases, and really coming together as a team and wrapping around these young people.
Thank you. And then for any of the other panelists, did you want to speak to a particular experience you've had with your local or state child welfare system and how that type of partnership has worked out?
I can, I guess. And I'll say I used to be a child welfare investigator, so I have some understanding when we go and partner with ASU, who is the Children's Bureau, one of the Children's Bureau grantees, to train our child welfare workers. One of the things that I talk to them about is that this isn't looking at through a lens any different than what you're trained to do. You're really looking at the welfare of the youth and how we assess that and ensure that their services and connections are really important. And so it's not a system that should be overwhelming in the sense that we're changing everything we're doing. We're just looking at it through this lens with training, with education about what these experiences are, and that they have unique needs. Victims of trafficking are a little bit unique, but in reality, if we think about youth that are in your programs that are running away, that are in the juvenile justice system, that are coming across this, it's not that different. And so I think that's really the lens we really try to educate our child welfare system on, is that it's just looking at a lens where there's a little bit of a different victimization, but it's not that unique compared to what you're already experiencing.
And I wanted to quickly add, most states have multidisciplinary teams and child advocacy centers, and those are unique resources that already exist. And by training them up and providing the additional supports that they may need to work with these kids, they are uniquely positioned to work with this population. So again, it's not about getting millions of dollars and creating new systems. It's about having that different lens and working with what we currently have and providing services to this very vulnerable population.
Thank you. And Melissa, you were talking earlier about the importance of prevention, including working with the child welfare system. But from your perspective, working with runaway homeless youth, how has the lens on human trafficking changed over time? Because it seems that runaway homeless youth programs for decades have been working with young people who may have experienced commercial sexual exploitation and trafficking. One of the runaway homeless youth program, Street Outreach Program study, recently interviewed and surveyed youth in multiple cities and found that 36% of them identified themselves as having exchanged commercial sex for something of value, whether it was food, clothing, housing, or even drugs. And could you speak a little bit to what you've seen in your field of the evolution of understanding of the young people you're working with?
So I think what's been unique is that we have run our own data through Arizona State University and other runaway homeless youth providers in our community, and our numbers were not that different. It was about 35% last year in our youth experience survey reported having a human trafficking related experience. And what we really look at is, does it look like survival sex? Because I think that's been part of the language within the runaway and homeless youth, that it's survival sex. There's not necessarily this third party that's trafficking them. But what we recognize within our own population is there is that third party, there is a trafficker, there is forced fraud and coercion happening. And so that really forced us to change the conversation in our community that, this term survival sex sort of minimizes the experiences that many of our vulnerable youth are having. And so what it really had us do is move forward and say we can't be left behind in this conversation, that often runaway homeless youth are also child welfare youth. Many of our youth have had experiences in the system, whether they lived in foster homes growing up and then they aged out and left, or within our minor programs, we have dual programs with community youth and child welfare youth. And what we recognize is that we couldn't pretend like it wasn't existing. It was negligent of us to pretend like these youth weren't having these experiences, or in the prevention piece, that they weren't extremely vulnerable to being preyed upon within our community. And so what we really did is, again, like Tammy was saying, it's not that you're developing a whole new agency or a whole new program. We looked at the resources we had. We partnered with some of our community agencies and started running a group that we call Sex Trafficking Awareness and Recovery. We called our STAR group. And what we really did is we started the conversation in our agency. We trained our workers to have the conversation in a way that wasn't shaming or blaming, but was really respectful of that youth's experience, but also being straightforward about it. Any of us who have worked with teenagers know that it doesn't really work to sort of beat around the bush. I think you build a lot more respect with them and rapport when you come out and have a really authentic conversation with them about potentially what their experience is. And with my own, going through our assessment, you'll have youth that'll say, no, that hasn't happened to me. We see it a lot for our minors. Our minors are far more reluctant to admit to their experience because they know, right? They've learned the systems that happen. You call the police, you call child welfare. I've had youth that on 16 and 17 have said that's never happened to me, and on their 18th birthday come and say, I'm ready to talk about it, because they feel like they have a little bit more control of their situation and their circumstance. But what we've really done is continued that conversation across our program. So So whether it's adult system or a minor system, we talk about it. We have posters, we have information and materials, and we continually discuss what human trafficking looks like, not only on the sex but on the labor side, because we've recognized that domestic labor trafficking is a significant issue in our community as well. And so it was really important to just start to intersect having that language, having some screening questions in our assessment tools to be able to start to identify it and then move to a separate assessment where we identify what that looks like. And then, you know, for most of our youth, any of our youth who we have identified as trafficking, they don't necessarily know that they're in a different program in our agency. For them, they just feel like it's part of all of the other services that we offer, and we've just learned to sort of tailor it to meet the needs that they have.
So Melissa, you brought up something that I think it'd be good for us to clarify with the participants in the room and via live stream in terms of the definition of human trafficking, particularly child trafficking. Within the runaway homeless youth community, the term survival sex has been around in the field for a while, and there has recently been changes in federal definitions around child trafficking. For example, child sex trafficking is now considered a form of child abuse under CAPTA, whether the perpetrator is a parent or legal guardian or not. And then also, in terms of victims and survivors of child sex trafficking, anyone under the age of 18, if they're involved in any type of commercial sex act, regardless of force, fraud, or coercion, they're seen as a victim of trafficking under federal legislation. And then for labor trafficking, if a minor is involved in any form of labor, but there is the presence of force, fraud, or coercion, they're also a victim of trafficking. And it seems, so I think in all of the sectors that are represented, there's often confusion or questions around the operational definitions of trafficking. What's trafficking versus domestic violence or sexual assault or other forms of child abuse? And perhaps that may come up during the question and answer session, but I just want to bring that up briefly for right now, because there's so many different terms that are floating out there, and then sometimes the local and state definition of trafficking is different than the federal definition, where the age of the minor or a youth victim of trafficking may differ from state to state as well. So thank you for sharing that perspective. And then moving on to the court system and turning over to you, Judge, around we've seen an increase in the amount of training provided to judges, including family court judges, and the concerns around, whose responsibility is it to protect the welfare and the safety of particularly child victims of trafficking? Is it juvenile justice? Is it child welfare? What's the role of parents and guardians? So very curious to hear your perspective of how do judges respond to the complexity of types of trafficking that exists in communities across the country.
I'd like to follow up on something that Tammy mentioned and that Melissa mentioned as well. We're not trying to create different entities. We're trying to use the structures already in place to expand the response to this situation. There's a famous poet from Chile named Gabriela Mistral, and she wrote, "The future for children is always today. Tomorrow is too late." Those of us who work with children have to keep that thought in mind. We don't have the luxury of waiting till they age out and go into the adult system if we're going to provide a constructive and positive intervention in their lives. That means that we can't treat children, whether they've been trafficked or not, as hot potatoes for one system to address or the other, simply because we feel we don't have the resources or we don't want them to strain the resources that we have. You cannot put a dollar sign on the life of a child. The life of every child is worth saving, and we should do everything that we can do about it. If we cannot provide functional family therapy and trauma-focused cognitive behavioral therapy, and all that we can do is give them a mentor, then let's do the best that we have do the best that we can with what we have. Give them the mentor and try to develop the capacity to provide other resources. Now, as far as judges are concerned, there was a mention of training. Training is really important here. One of the things that we realized when we began the conversation regarding the commercial sexual exploitation of children is that the cases weren't being flagged down because a lot of people didn't see what they had in front of them. And once we conducted training and we started the conversation, then all of a sudden, the referrals to children's hospitals started happening because people could identify what was happening, which previously they did not see. I'd like to point out a couple of resources that are available nationally as far as training judges specifically is concerned. The National Council for Juvenile and Family Court Judges has a domestic child sex trafficking institute that's provided several times a year. The next time it'll be provided here in DC in late September. There's also an entity called the Human Trafficking in State Courts Collaborative. It's an effort through the State Justice Institute. And there are different organizations that support that effort, including the National Judicial College and the National Council of Juvenile and Family Court Judges. Go on their website, get all the information that you can. Check it out. We realize that children who come to us having experienced sex trafficking have a wide range of challenges. They have been traumatized and manifest mental health problems. PTSD, serious depression, suicidal action. They have been out of school and are hopelessly behind on their education. And oftentimes it is inappropriate school placements that might have contributed to making them vulnerable to being trafficked in the first place. They might have developed serious substance abuse issues as a result of their experiences. They have strained family relationships which led to them being trafficked or have been strained as a result of the trafficking experience that these children have had. They are invariably self-destructive, many of them. They will resist services, they will be inclined to run away, but that doesn't mean that our efforts have to stop. We have to continue, we have to work collaboratively. Again, no one entity can do it all. If there's a place and a space in the child welfare system, in the juvenile delinquency system, where everybody really must come together and do what we can, it's children with children who have been trafficked.
Thank you. So, Judge, you mentioned a number of short-term and long-term health and mental health consequences that trafficking has on young people. And so I'm going to turn over to Dr. Dye and what she has been seeing, whether you're getting referrals from the court system or from child welfare or community-based programs, or you're providing referrals back to the community. What do you think, how do you think the healthcare system and healthcare professionals are currently equipped to identify victims of trafficking, respond to the issue, and what do you think is needed to address the health needs of survivors of trafficking?
So much to discuss. So the children or the youth that I see who are suspected of having been trafficked or have disclosed being trafficked have tremendous health care needs and tremendous mental health needs. And I've been surprised when I started getting referrals from the court system, from CPS workers. I thought that I could fit them into a regular slot. I could sort of address everything in an hour. But as I began to see more and more patients, it just was astonishing, the number of healthcare needs that they had. Bed bugs, urinary tract infections, sexually transmitted infections. Over 70% of the female patients that I see have pelvic inflammatory disease. I've had a number of girls who are pregnant. The mental health needs are really overwhelming, and trying to address them and work with the court system and with CPS to find an appropriate placement for them. and the educational needs that the judge spoke to as well. So in addition, you know, these children need assessment of prior trauma that they've experienced, so trauma in the home that they experienced previously, trauma that they experienced while they were being trafficked. And thinking down the line, addressing these mental health needs are going to go a long way to preventing future health needs or future health consequences. So thinking about the ACEs study, adverse childhood experiences, if we can intervene and address the needs, the mental health needs now, I mean, what a public health intervention that could be. So we know that youth who are in trafficking situations, up to 87% of them encounter a healthcare professional while they're in their trafficking situation. And I think, like a lot of the other panelists, until recently, I don't think that healthcare providers really knew what was in front of them. And unfortunately, you know, if you're working in the emergency room, if you're working in a clinic, you may only have 10 or 15 minutes with a patient before you have to move on. And it's a struggle because it would be great if you had some kind of screening tool. None of the screening tools have been validated in a healthcare setting. There's one in San Francisco that recently has been. But you have a very short amount of time, and a lot of the screening tools that I have seen ask really invasive questions, and, you know, one right after the other. And in my experience, I think that if as a healthcare provider, you know, this is a one instance where you're going to interact with a patient who may not be identified to any of the systems. If you begin to ask really invasive questions, you're not going to get an answer. They're going to shut down, and they may not actually want to come back to get care. And so I think one of the biggest things that institutions can do is think now about what would happen if somebody came in and that was your concern. At Children's, we're really blessed in that we have a wonderful social work staff who I work with, and they help train providers to understand, you know, when you begin to ask, you know, to trust your gut. When you think something is going on, to watch body language, and to begin to ask questions, but not right away. Have you ever traded sex for food? You know, if you start going down kind of a checklist, you're not going to get where you need to. And so I think that's one of the big things that the healthcare field needs to work on is once you sort of get that gut feeling based on clinical indicators, how do you ask the questions so that you get an honest answer and you may be able to identify these patients, and then what do you do from there?
So along the lines of screening tools, one thing that I've seen be effective, especially for those clinics and places where they don't have a lot of time, and it's a tool that they use for domestic violence, and I've seen it be successful, although it's not validated or anything like that, is having a piece of paper that has a couple questions on it. Usually it's just a little laminated paper, and a nurse handing it to a patient saying, if you can answer yes to any of these questions, I want you to point to it for me. And that takes the responsibility off the survivor to have to communicate their trauma, which often if they're on that other side of the brain, they may not be able to communicate their trauma. They may not have those verbal skills to be able to get those words out. So I'm a big fan of that screening tool, especially in quick type situations. And even if that person doesn't disclose then, there's a knowledge that, hey, this person knows what I'm going through. And maybe not this time, but maybe next time I can have the courage to say something.
Since we're discussing screening tools, I just want to mention that Here in the District of Columbia, we developed the first validated screening tool for use with children who are in the court system to help us identify youth who have been trafficked or who are at high risk of being trafficked. There was an article published in the May 2016 edition of the APA Psychology, Public Policy, and Law, which is titled Toward the Discrete Identification of Commercial Sexual Exploitation of Children. The authors are Dr. Woodland, Dr. Watkins, Dr. Barnes. And they have developed a questionnaire which consists of 12 questions, 9 of which are posed to the youth. The other 3 are for the screener to respond based on his or her observations. If the youth, and they're very discrete questions, all the questions have been identified through research. If the youth scores high risk, then it's something that we, because they're involved in the court system, we connect them with a mental health professional. The mental health professional is made aware of this concern, and hopefully that's where the disclosure will take place, within a safe context, after the child has had an opportunity to develop a relationship with that provider. It's not something that you ask right off the bat. It's not something that you can approach explicitly, because that will only cause the youth to pull back and be more reticent about engaging with you.
And then, speaking of additional screening tools, it's great to know that there are community-based and hopefully survivor-created screening tools as well. And Diana, I'm going to come to you shortly on that. But also, in terms of federally funded and validated screening tools, we're so glad to hear of the one that the judge mentioned. The Department of Justice had funded a screening tool that could be used particularly within criminal justice settings and for adult populations, and that was created by the Vera Institute, and you can find that online. And currently, the Department of Health and Human Services, we're piloting a youth trafficking screening tool in child welfare and runaway homeless youth settings, and the results of that should be out in early spring of next year. So please keep that on your radars. And part of the creation of that tool was to survey all the other existing screening tools out there on child trafficking, both sex trafficking and labor trafficking. So there are many initiatives in the works, and hopefully they'll all feed off of each other as we build the evidence base for the field. So Diana, I want to come to you as survivor consultant, at least in terms of what the federal government has been doing, especially over the last few years. There's been an increased focus on survivor engagement, survivor leadership. Within the Administration for Children and Families, we've actually incorporated requirements or preferences around survivor engagement for certain grant opportunities related to human trafficking response. And so from your work and the discussions you've had with other survivors, what would your recommendations be for the professionals represented on the panel, in the audience, via live stream, of how to meet the unique needs of victims of trafficking and respond to the issue generally?
So as far as the unique needs of survivors of trafficking, I think it's really important that you see every individual in front of you as a unique person. Don't assume because someone has been trafficked that they fit into a certain category and they have the same needs that the last person that has been trafficked. One girl who I worked with who had an abandonment experience by her mother felt that experience was much more pressing on her than her trafficking experience, and she was put in to specialized trafficking care, and it wasn't what she needed, and she didn't feel heard, and so she left the program. So listening to a survivor's perspective on what they need and not assuming what they need is important. Figuring out what those needs are and helping get those needs met are definitely a next step. No one person can meet all of a survivor's needs. I love that we've heard that over and over again. The other difficult part of that is most of us don't have jobs where we have extended amounts of time to spend one-on-one with someone. So utilizing resources from existing partnerships or stretching out and forming new partnerships so that all these different needs can be met. And when I'm saying needs, yes, medical care, mental health services, trauma-informed services. We know kids need those. But what about when they want to go back and they need a distraction and they need to go to the movies with someone so that they can feel normal for an hour? Those types of needs are also important if we're going to give a complete care package. And so using, court-appointed special advocates, boys and girls clubs, mentoring programs, faith-based groups, getting those resources are important because their social worker may not have capacity to meet all those smaller needs that are still just as an important part of the puzzle. Also, I'm hearing from survivors that one thing that I hear is that at all levels, from people who are just out to people who have been out for 10 or 15 years, is not feeling like they're being seen as a person. We've done so much to identify victims, which is great. We've needed to do that. But now victim identification is becoming a process of labeling, and we're going to wrap it up in a nice, neat little package. And sometimes people want to be seen as more than just their trafficking experience. It can be frustrating, it can be limiting when that's all people see them as a trafficking survivor. Survivors are much more than their trafficking experience. That's a part of a whole picture. Just like people don't experience grief in the same way, survivors are not going to frame their trafficking experience in the same way. And also similar to grief, the healing process can be very consuming initially. However, there is a life and a new normal beyond trafficking, even if it's a lifetime process. So even if you've seen the same situation 500 times, the person in front of you is a unique individual. Treat them like one. See them for their strengths and weaknesses. See them for their potentials, which they do have because they've survived horrendous things. And see them as a whole person, even if they don't see themselves as one yet.
Thank you. So one of the themes that have come up from multiple panelists is around the concept of normalcy. And there was recent federal legislation around normalcy, and we're talking about prevention and connecting young people to community resources, whether it's mentors or mental health providers, the role of parents and including foster parents. So would any of the panelists like to provide examples or speak to the importance of practices around normalcy to help prevent trafficking or intervene at earlier stages for those who may be experiencing trafficking?
I can start. So at Tumbleweed, we have 2 different young adult programs, so independent living programs for our youth, 16 up to 21. We have community beds as well as child welfare beds. And in our community, and I think a lot of our communities, they go back and forth on what's this right fit. And I think all of us have said there's no one fit model on how to work with a victim. And so what we've really seen is we've seen an increase of referrals into our young adult program. And I think it's been really beneficial for a lot of the youth that we've seen. We are transgender friendly, so we've seen a high increase of our transgender victims that are within the child welfare system being referred into our program. They get their own apartment, but we have staff 24 hours a day, so it's a bit unique compared to like the group home setting, but it really gives them that autonomy and that capacity to really make decisions. And I think that's a big thing, especially when we're talking about working with minors within the child welfare system that have been victims of trafficking. If we continue to tell them all the things that they need, we're taking away their voice, just like their trafficker did. And so we have to be really cautious about that process. And so what our young adult program is giving them the capacity to make decisions. Where do you want to go to school? Let's talk about work. Let's talk about volunteering. Like Diana said, it's so important to look at how we work within the community, because as social workers, we can't do the one thing that most of our youth need, and that's love. We can give them compassion, we can give them empathy, but most of us do not have the capacity to hug them and say, I love you every day, right? A little bit of our boundary issues, but they need that. They need those people in their lives, whether it's family supports, whether it's friends, whether it's a mentoring program, to really help them look at when you turn 18 or 19 or 20 and you go and live on your own, how do you have a network around you that's going to continue to support you and give you those healthy relationships and boundaries that you need moving forward. So I really, encourage people to look at all the programs they have within their community, and just because someone's been a victim of trafficking and they're at higher risk and they may be more vulnerable, survivors have a lot of life skills and you have to give them credit for that. So I think it's really important to look at independent living programs or or living skills classes to really reintegrate them into those sort of things and give them the credit that they can be really successful in those programs and that they don't need all these different service providers to be working with them because they have the skill set to maybe meet their own needs in a certain capacity.
I think everybody said it very well, not to put these young people in a box. They are all very unique. They're typically adolescents. We've had some younger, and they want to be normal adolescents and normal adults. And what I've seen when we do trainings across the country is that people, once they hear this, they want to build a very special place for them that's all about trafficking or provide a very intensive service, and in 6 months everything will be better. But what seems to be, and what we're seeing in our work, is that those long-term relationships tend to be the most effective for them. Those mentors, those foster parents, that kin home. And there's services you can wrap around them. In Connecticut, we have something called Survivor Care that's run by a wonderful organization called Love 146. And they will work with that child no matter where she's at. She can be home, she can be in a group home, she can be in a hospital, she can be on the street calling them at 10 o'clock at night. But it's about giving them the normalcy, not putting them in a box, not exploiting them further, and then really helping them become successful young adults and kind of riding that wave with them, because they're gonna relapse at times. They're gonna have struggles. We all, I think, probably remember our adolescence. We've all had struggles. And then when you magnify it based on what they've been even prior to being exploited, it's even more complicated, but they can do it with the right supports.
I think what's also important to the fact, speaking of normalcy, is redefining success and looking at that individual and what does success mean to them. Maybe getting them to go to a summer program, going to summer camp somewhere. That can be success. They stayed out of the life for that amount of time, and they had a positive experience that might make them want to come back to placement. So definitely redefining success in the framework of that child's needs can be important in defining that normalcy.
So one of the other challenges that professionals in the field often raise is how do you balance the goals around normalcy and empowering survivors of trafficking, focusing on their resilience and all the positive aspects of coming out of a very violent and exploitative situation with safety concerns, so particularly from whether it's safety concerns from parents or from within the criminal justice system. What does safety look like, particularly for child victims of trafficking under the age of 18, from your particular professional perspectives? And I don't know who would want to address that first, but what does safety look like when you're trying to balance with those other factors?
Safety depends on the circumstances of an individual child. As Mrs. Neto said, each child is an individual and we have to treat him or her for who he or she is. When we interact with youth, we cannot assume that there's a magic approach that will resolve each and every situation. We have to figure out what's going to work for this young person or what's not going to work for this young person. That carries over to the concept of safety. What might be safe for one youth might not be safe for another, because the circumstances are different. Their state of mind, their family support or lack thereof, any mental health issues they might have, any self-destructive behaviors they would manifest. Ultimately, I think each of us has to figure out what's going to work for the youth with whom we're working. I just want to mention an issue that I know is very delicate, at least within the court system, and that is the concept of what do we do when we basically have run out of options as far as keeping this youth safe. And you know what I'm talking about? I'm talking about the controversy regarding the use of secure facilities, the controversy regarding the use of detention. That's something that each of us will have to answer for ourselves, what we find acceptable and what we don't find acceptable. I can only say that from my perspective, if I have run out of all options and I have to choose between this young person going out there to be raped 8 times a day, maybe beaten up every now and then, subjected to all sorts of diseases, or keeping them in a secure place, you probably know which way I lean, right? But that's only because I have no other option, number one, and number two, for a short a period of time as possible until I can get that young person out in the community with the support services that he or she needs to be safe. And again, there is no right answer. I'm only sharing with you my perspective. It's okay if we agree to disagree.
Very well said. I think what I'd like to stress are 2 things. One is that when we're talking about kids that are survivors of trafficking, they're victims. And we've had survivors ask us when we're working with them, where is my trafficker? Where's my pimp? And we've had to tell them, well, they're at home because they got out on bail, but you're here in a hospital and you can't get out the front door. So that, that comes into conflict with them as well, saying, all right, you're telling me I'm a victim, but yet my trafficker's out on the street. So think about that. But we have to hear it from the kids. Many times they will help us judge how safe they are or not. And I've seen both extremes. I have seen kids where we thought they were very, very safe, and the kids are telling us, no, this is going to happen, my trafficker is going to come get me, and I'm very, very high risk, and we've ignored their warnings. And I've seen the total opposite, them telling us that everything's fine, and us knowing something really bad is going to happen. So you really have to assess each individual kid, but really keep in mind that these kids are victims, and they know that. They're hearing that from us. That's part of what we're training. That's part of what we're teaching. So we can't give them multiple messages, but there is a balance, and we have to sort that through on a state-by-state basis. In Connecticut, we do not lock up victims. The only young people that will go into any type of secure care is a kid that has delinquency commitments.
I'm definitely not a proponent of locking kids up on a regular basis. I think things need to be taken on a case-by-case basis. But I do want to say, if there is a situation where a judge or whoever is in charge of that kid's life feels like they have to be locked up, then you need to do it in a proper way where you're explaining to this child why you are doing this, how long it's going to be, and what kind of help you want to get them by taking this action. Because I've known kids that have been locked up and they said, well, you know what, that's what my trafficker said was gonna happen, and then that's exactly what happened, so why would I go back into placement? So if you have to go that route, do it in a way where you're communicating with that youth and you're explaining to them why this is happening, not because they're bad, not because you're blaming them for the trafficking, so they don't take that on and then add an additional layer of trauma.
I think I just have to say trauma bonds are real. So, especially with minors, I mean, I think struggle the most when we're talking about safety with minors compared to an adult. And the reality is by trying to villainize that person, a lot of the victims we work with, that person is someone who loves them, or they believe that loves them very much. And so to say that there's this mean trafficker out there, that's not how most of our victims see their trafficker. They don't see them as that big bad wolf. It's someone that met a lot of their needs, told them that they loved them, and kept them safe in a very, disconnected sort of way of safety, right? And so we've had a lot of success with having them define their own safety plan, and also giving them options and recognizing, if you run, these are some options, or if you leave, when should we be concerned? And letting them sort of guide that conversation with us has been really successful. We're a Safe Place contractor. Most communities, at least not most urban communities, have Safe Place in your community. It's a national program that's run, and youth can go to, for our community, it's a quick trip, it's a gas station, say I need a safe place, we come and pick them up and take them back to our shelter. So we're always trying to develop, even if you do run, these are the safe options that are available in your community. You can go to a medical facility and say that you need help. You can go to a shelter and a police station and really identify that. And for a lot of our youth, cops are not positive people in their lives. So saying go to the police is not always the most reasonable option for them. So really helping their voice sort of guide that safety process has been a really important thing for our team to really look at.
I mentioned Love 146. Part of their survivor care program is they provide what is called a rapid response, and it's a one-time intervention and very, very much focused on safety planning. So that young person knows when he or she is back out into the community, if she or he decides it's time for help, I'm unsafe, they know some of the things to do. They do a practice call to the national hotline number. They talk about internet safety. They talk about relationships. Again, it's very much like we've heard about safety planning. So when they are ready, because they're going to relapse, that is probably one of the biggest challenges with this population. They're very bonded to their trafficker. So when they relapse, but when they're ready for help, they know how to get it. And it's not, a lot of times kids are fearful. If I call the national hotline number, police are monitoring it, and then they're all going to swarm around the phone that I'm calling from. So getting, some reality there for them and just knowing there's people out there that'll help them when they're ready, we have found very helpful.
So in a few minutes, we'll be opening up the microphones for question and answers and for any participants on live stream. I think there are instructions on how you could submit questions as well. So please prepare any questions you have. Feel free to come up to the mic or submit the questions online. As we go into, after this final question, we'll open it up for participant questions as well. We've talked so far this afternoon on cross-sector collaborations. No one entity, organization, sector, professional area can do it alone. We know that there are many other types of partners that aren't represented on the panel today. So from the expert panelists, would you want to share some unique types of partnerships you've had, so the not so usual suspects of how you've been able to work on prevention or reintegration into community, family, and one of the examples I want to bring up, even within the private sector, the runaway homeless youth field through the National Runaway Safe Line, partnering with Greyhound. Greyhound has a program called Home Free, where they provide free bus rides for young people who are runaway homeless, but also now trafficked, to be able to return home. And that's one way of leveraging partnerships and costs of transportation so that someone can get home safely, as an example. But are there any other scenarios or cases that come to mind of other types of partnerships where you've worked with the community or other professional areas?
Sure, I'll jump in with that. We have an amazing relationship with an organization called The Underground, and it's a faith-based network in Connecticut. They have some incredible leadership. They have probably over 100 churches at this point involved. And they do everything from education. They've been trained in all our curriculums, so they do regular events in the community to educate community members, all using the same language. At those events, they recruit foster families, they recruit mentors. They also provide, any possible resource we need for these kids. So if we called them up tomorrow and said we need survivor backpacks, they will be all over it and we'll have them within a couple of weeks. If we have a young person that has a specialized need and we don't have a funding source for it, they find the money for us. Absolutely positive support for the state. And, folks have asked, because it's faith-based, is it, heavily based in religion? Is that complicated for the kids? They really have met our kids where they're at. We have not felt that there's been any push toward any type of religion. We've seen events and we've seen discussions with kids where faith has not been brought up at all. And then I've seen events where it has, because it's really part of their community and their network, and it's been a very positive resource for us. So I think, we have some great relationships with U.S. attorneys, states attorneys, private providers like Love 146, who has fundraised for years for services. But I would feel amiss if we forgot the faith-based community, because they have been a significant support in Connecticut.
I want to hark back to something that Tammy mentioned at the beginning, and it's the multidisciplinary team approach to making sure that we wrap services around the youth. One of the things that we have done here is, with the assistance of our own Child Advocacy Center, set up a monthly meeting where kids who have been identified as being at high risk have the benefit of a conversation between the different service providers to identify who can best provide a support for this youth. Part of this conversation involves the Department for Behavioral Health, with an access to different therapeutic modalities, Court Social Services, which is our probation agency, the Department of Youth Rehabilitation Services, which is our deep end juvenile delinquency agency, Child and Family Services agency. We also work very closely with groups like Fair Girls, who are community-based and who can provide a more direct hands-on support for the youth that we see. So, in terms of collaboration, it's important to create the space where the communication can occur and the opportunity to get to know each other can take place. Otherwise, we're just working separately without any communication. And if we do that, we're really dissipating any type of impact that we can have in supporting our youth.
All right, so at this point, we will start taking questions. If you have a question in the room, please come up to the microphone. And then again, if you're dialing in via live stream, please feel free to send it to the email address in the instructions.
Hi, my name is Hannah Haley. I'm with an organization called West Coast Children's Clinic, and I actually have a comment as opposed to a question. Oh, hi, Rana. I just wanted to share another option for a validated screening tool that exists, a commercial sexual exploitation identification tool. We just completed a validation of it based on data screening data of about 5,500 youth in California. The data was collected in almost 56 agencies, including the 9 counties participating in the Preventing and Addressing Child Trafficking Grant in California. And we're also in the process of finalizing a version for child abuse hotlines. So I just wanted to share that as another option. Again, as West Coast Children's Clinic, I'm happy to share information with anyone about that.
Just like to add real quick on screening tools, especially for youth. And when we're looking for red flags and symptoms, really make sure that your screening tool is looking for both the symptoms of acting out and acting in. It's a little bit easier to catch those kids who are chronic runners and have substance abuse. Those signs can be a little more outward. But when you look at studies for sexual abuse and for domestic violence, and I think we're going to see it more with sex trafficking for children as well, there's the quiet kids that act in. They may be cutting, they may be doing other self-destructive behaviors that aren't as external. So when you're looking at those screening tools, if you could look for looking for both types of situations where a kid is acting out or acting in, that way we're getting those kids that aren't necessarily yelling in our face, and we're catching those kids that are falling through the cracks a little better as well.
And we found, just to go off of your question and tying into this, is that schools have been a really great partner because they often see those changes in behaviors that are really small nuances that we might not see, or they don't come to us at that point yet because they're not running away or something like that. But all of a sudden they see this big shift of behavior, whether it's a youth who was really outgoing becoming really quiet, or signs of trauma. So that's another great partner and champion we've seen in our community to really help us connect the dots as well.
Next question? Yes.
So you were talking about MDTs, and I'm from Oregon. In Oregon, the MDTs are really primarily, well, none of the advocates would be there. None of the advocate groups, domestic violence shelters, sexual assault shelters, etc. And so I was wondering about, with the focus on MDT, how do you get the other participants who aren't generally the MDT members there, service providers and things like that? Just wondering.
Sure. I'm sorry, it's really hard to see everyone out there. It's so bright. In Connecticut, we have MDT coordinators over each of our MDTs, and they're very knowledgeable with the resources in the community, so they're able to make those connections. In regards to survivor care, I mentioned earlier, they're now attending some of the HEART meetings, so they're able to actually start some services. That it hasn't started statewide yet. We now have statewide resources, but they're training up their staff at this point. But they too will be a resource. And then the other relationship we're very focused on right now, and one of my HEART liaisons is here today, is the relationship between our regional HEART liaisons and our MDT coordinators, and how to strengthen that, because the HEART coordinators are seeing every case in their area, and the MDTs should be teaming these cases. So the more they collaborate, the better the outcomes for the kids as well.
One of the issues implicit in your question is confidentiality. And confidentiality rules vary from place to place. The confidentiality rules in Connecticut might allow for the providers to be at the table. The confidentiality rules in the District of Columbia do not. That means that we engage, it's the individual caseworker or the probation officer or whoever is working with the youth who is part of the MDT conversation and then sort of is a conduit to bring the community-based provider into the conversation, even though the community-based provider is not at the table when the conversation takes place.
California is very different from county to county, but I know in the counties that are a little farther behind, it's been a process of being able to develop MOUs, and I know that's not always possible, but when it is possible, even though it takes more effort, it does make the process, it can anyway, make the process a little more seamless of inviting those community partners to the table.
So in DC, the human trafficking MDT was born out of the sexual abuse MDT. So we began with all of the players who were at the table to discuss cases of suspected child sexual abuse. And then the Office of the Attorney General was able to invite other district entities, but getting the community players, so we've sort of got that up and going. But we need to create the MOUs to get more of the community players at the table. And it can be difficult because of HIPAA constraints, confidentiality constraints. You know, so it's been awkward at times where we've had to say, you know what, we're going to have you step out of the room right now. But we're working on it because that's really in the best, you know, what the youth really need.
One of our biggest obstacles is that for MDTs in Arizona, you have to be working with prosecution. So what happens to all those victims who aren't willing to cooperate with prosecution or maybe do not have a case that prosecution will pick up and prosecute? Because that definitely happens within our minors. We still hear in our community that's prostitution, even though, like Catherine said, we'll say that she's 16, that's not prostitution. Like there's a federal definition now. And so what we've actually started to have a conversation around in our community with our victim subcommittee that's based out of our task force is what if we just start to have our own MDT? We all really like the MDT model. We think it's important because there are lots of people that don't always come to that table that have valuable information to share. And we understand that we think we're probably serving the same person multiple different times. And what would happen if we came together and had that communication? That's probably about 6 months out for us. So that's to be continued for Arizona. But that's something that we've really talked about because we feel like there's a lot of people who are in need of that sort of approach that are missing out because of that prosecution element not being present there. So that's something our community is really starting that conversation around.
That's definitely a challenge, and I think we are working through it pretty effectively in Connecticut. Number one, we consider sex trafficking sexual abuse, so it now falls under mandated reporting. So under all of our trainings that schools getting, law enforcement's getting, we talk about trafficking as part of sexual abuse. So it's an automatic okay to go into our MDT teams. And our MDT teams are supposed to be focused on ensuring the child and the family have a response that's coordinated. Having increased prosecutions, absolutely an ideal second step, but really the main importance of an MDT is to make sure that that child and family is getting services. There's not multiple interviews. They don't have multiple services being thrown at them all at the same time. So really getting our MDT teams, and we started doing this a couple of years ago, in that framework with this population has helped. Now, these cases take more time, which is always challenging, and what they have found, some of our MDT coordinators, is sometimes they've had to have a second kind of meeting or a continuation of a meeting on a particular case because they've run out of time, and some of the folks in the room have had to leave for other, other business, other work business. So those meetings have been extended or added to, but we are very comfortable in Connecticut using the MDTs at this point.
We have a question from our online live stream audience for the panel. The question is, how are different states, if at all, are you tracking victims of trafficking within your child welfare data collection systems or through other mechanisms?
So in Connecticut, we have been working tirelessly to automate our data collection, and we're very close. It should happen as of October 1, which is really good news. But what we have been doing since 2008 is we track it manually. Our heart liaisons, at the end of every quarter, they're documenting every case and a number of elements that we have been interested in tracking. Our system that will go into effect, actually it goes into effect September 2nd. We probably will start using it the next quarter, which will be in October. We'll track a number of indicators as well as long-term outcomes for these kids and long-term outcomes of these cases through prosecution and so forth. So we've kind of phased it, and it's been a lot of manual work, and then our heart coordinator, who's also here and is wonderful, what she does on a quarterly basis is she takes the data from all the coordinators and then she provides a statewide report so we can see what we're looking at based on individual offices, individual regions, and as a state.
So this question around data collection comes up a lot across federal agencies and the Department of Health and Human Services. We have an initiative underway called the Human Trafficking Data Collection Initiative, very descriptive. And what we have found when surveying whether it's child welfare, runaway homeless youth programs, anti-trafficking organizations, and other community-based entities is that there is a federal definition of human trafficking, different state and perhaps different state and local definitions of trafficking. But one of the challenges to data collection is the lack of uniform data standards when it comes to human trafficking. And so under this initiative, we have gone through multiple rounds of engagement with a diverse set of organizations representing the sectors here on the panel and other systems of care to see, could we have some uniform data collection standards or elements that we can share? How can we make data collection interoperable so that the data that's being collected within child welfare, we can somehow connect that to data within juvenile justice, to runaway homeless youth programs, while we protect the security and privacy of personally identifiable information. How can we better leverage different technological resources to make it easy for case managers and service providers to input data or to upload data, so we're minimizing the barriers to collecting data, is particularly among small local victim service organizations. And so that's an effort underway. We will be releasing these draft uniform data collection standards in the Federal Register for public comment shortly in the coming months, and we'll stay tuned for that. But data is a big question that multiple sectors are asking, particularly within child welfare because of recent federal requirements. Any other questions from the room, or Dr. Dye?
I just wanted to point out in the healthcare field, there's no ICD-10 code for human trafficking, so there's no way within the health field to go back and look at insurance codes to pull out to see how often we're encountering trafficking within the healthcare system. And it also it's very hard to capture and relay appropriately the acuity of the visits that we're having. So, you know, the best that I can code when I see a patient is, you know, initial suspected child sexual abuse or child physical abuse, but that doesn't capture the entirety of all the different health issues that are being addressed during the visit.
Just following up on what the doctor said, one of the ways that we've tried to expand the availability of services for youth is going through the local Medicaid plan and seeing how we could use Medicaid dollars to pay for things like cognitive behavioral, trauma-focused cognitive behavioral therapy or other therapeutic interventions that would benefit youth. We've been somewhat successfully able to access Medicaid dollars, so it's not the agencies themselves that are paying for the services. Maybe that would be an option in your jurisdictions, maybe not, but it's something to consider.
Yes.
Diana, can you help us understand what it means when we talk about survivor engagement and kind of give us your perspective on some ways that we can do that that's appropriate?
She's going to hear about this afterward because I actually know her really well. Rana is our PACT coordinator, and she actually does a very excellent job of survivor engagement. She creates places at the table for survivors, and I couldn't do that as a survivor. I can't force, neither would I want to force my way in, but creating a place and a space that's appropriate for where the survivor is. That can be anywhere from being in your steering committee meetings to meeting with another peer one-on-one who they are just a little bit ahead of. So there's multiple places where survivors can be involved, and I really encourage survivor involvement at every single level because they've been there. And there is just something about being there and having an experience. You have a unique perspective that other people don't have because it is personal to you. So creating those spaces for survivors, giving them a voice by giving them a place at a table can really be changing within your organization because they can be able to point out things that you wouldn't have thought of because of their unique perspective.
Oh, go ahead, Tammy.
I just wanted, you asked if there was anything else we wanted to bring up. We briefly touched probably midway through on prevention, and we were talking about kids that were high risk and we were concerned about. But I think we really have to talk about very early prevention. We are seeing kids younger and younger being exploited. Some of these kids are our most vulnerable, connected to child welfare. Some are not. But what we're finding with these young people is they don't see themselves as victims. They idolize pimps. There's some normalcy in our schools, in our young people right now about this type of activity. And if we're not getting to them at an early age and really talking about this issue, we're really missing a key opportunity. I'm aware of there's a few good curriculums out there. There's two that we use in Connecticut. We use My Life, My Choice, which is a 10-week curriculum just for girls. And then we use Not a Number, which was, it's a 5-week curriculum developed by Love 146, and that's for girls, boys, or LGBTQI youth. And what we are finding is, one, it's helping educate our kids so they know what this is, so we can start to give them the protective factors from a very early age. Usually around the age 12 and up, these curriculums are appropriate for. And then we've also found that kids that are going through these curriculums often will disclose that they're a victim. They start to understand what this is, and usually midway through these curriculums, they'll self-identify. So it's great. We're all talking about CSEC and DMST youth and how our systems are evolving to reach out and support these kids. But if we don't start educating these kids in the communities, in the schools, we're really missing a unique opportunity. It's great to hear you have some good educational commitments. That has been really challenging for Connecticut. Some schools have welcomed us in. We've done some trainings for their staff, and we started to do some groups for kids, but it is painfully slow. So the more we can get our educational folks at the table, I think the better nationally.
I think also having survivors in that prevention education role can be very, very effective. Kids spot inauthenticity really quickly, and having someone who's been there and can say, yes, this is a real problem because I went through it, there's something about that grabs kids' attention in a unique way. So that's another great way that you can incorporate and engage survivors.
I think I'll say with schools too. We don't have a great in with schools. We have a great in with school social workers and the homeless liaison. So sometimes you have to look at who those partners are. And like we held a summit last summer and we did it purposefully after school was over because school teachers were saying, we can only go to our district approved trainings. We would have to take a day off to go to your trainings. So we held a training during the summer that was specifically targeted for school professionals to come and learn about what this looks like because we know their district themselves doesn't. So I'll say that's the caveat. We haven't been super successful. They're like, don't talk about sex. It's like, well, it's sort of difficult. The other thing with prevention that we're doing is, along with we've done My Life, My Choice, and like Tammy said, 5 out of the 6 kids, the first group, disclosed, and we thought they were at risk. We didn't necessarily know every single one of them had had some sort of exploitation as a minor. We're also doing a group called I Am, which is a male-based curriculum. There's a couple male-based curriculums that are out there along with the one that Tammy mentioned that's sort of for dual entities. And it really talks about what it's like to be a male, specifically a male minority in our culture and what that expectation is. Because even in My Life, My Choice, we talk about what does a pimp look like? And they sort of throw out all these stereotypes, but these are all the people that they surround themselves with. So if this is what someone that we're talking about is unsafe looks like, but you're saying this is all of your boyfriends and your friends that you surround, there's a bigger issue going on about how society views some of the behaviors and the acceptability of some of the things that are now sort of the norm for a lot of our youth. So our goal is to really launch I Am into our young adult programs with men that are 16 to 21 and really talk about our young men, what this looks like, and each week is like, I am a pimp, I am this, and it really challenges them about what society has told them they have the potential to be, and it transitions to I am whatever I want to be, right? Like I can be whatever I want to be, and I don't have to sort of be what my family told me I'm expected to be, especially when we talk about familial trafficking. That's a big thing when it's ingrained in that family network, and so it really challenges a lot of those things. So part of it is getting really creative and not just looking at the victim element of it, but how we also talk to, there goes my hearing, young men about this, and young women, because they can be traffickers as well, and being really fluid in that conversation.
So as we're waiting for more potential questions from participants here in the room and online, Tammy, you mentioned age or in terms of other trends regarding trafficking that you're seeing within child welfare in the courts or in healthcare or in runaway homeless youth programs or other community-based programs. For the panelists, are you seeing any particular trends recently that could be helpful for the session participants in terms of what to look out for? For example, we've been hearing among our grantees increasing reports of child trafficking or trafficking generally and substance abuse, particularly heroin and the opioid epidemic and some of the cross sections there. Are there any other trends that you're seeing within your systems of care?
So, we've spoken briefly about interfamiliar trafficking, and I think we all understand that's where the parent, guardian, or entrusted caregiver is the trafficker, the buyer, so forth. What we are also seeing, and it goes along the lines of whether there's a third party or not. In Connecticut, we accept every case, whether there's a third party, a pimp involved or not. It doesn't matter who the parent, guardian, or entrusted caregiver is. We will actually support them through our system. But with interfamiliar cases, we're seeing some scenarios where kids will be living at home. They'll have a job. They'll work at Dunkin' Donuts. They'll work 12 hours a week, and on Sunday, they're handing their mom $800. Now, mom is not trafficking their child. They're not posting them on Backpage, which is where the majority of our kids are posted. but they're not asking the questions, where are you getting this money? And when we train, we talk about, if we could make, $1,200 working at Dunkin' Donuts, we'd probably all have second jobs. But we're not asking those questions, and they're not falling under the interfamiliar case. So if we're starting to look at trafficking and we're including the survival sex, we have to start looking at this piece as well. There's kids out there that are surviving on their own because they've run away due to multiple circumstances, and they're also supporting their family, which we have to start diving down into.
Within our programs, just astounding numbers of our LGBTQIA and especially our transgender youth that have had trafficking experiences.
Kids are also exploiting each other. We had a 15-year-old girl exploiting a 16-year-old girl, transgender, male-bodied, female-identified. So again, there's a lot of normalcy in this life right now within our communities, within our schools, with our adolescent population. So we're seeing kids recruit other kids. Also interesting in our data, so last year we had 133 referrals. Well over, I don't remember the exact number of that May, 67 maybe, right around there. Those kids were at home when they were trafficked. So when we start talking about child welfare and paying attention to these kids, the other push that we're doing when we're doing our community trainings, it's not just the kids running away from group homes and foster homes. They absolutely are super high risk because of their past vulnerabilities, but the kids that are at home are also at super high risk.
Also, one thing that we're hearing more about in the news, which I'm glad we're hearing about, but we're not really addressing, is trafficking within the religious communities. We don't want to think about this happening within our churches, but it very much is, and that was one part of my trafficking situation, and I think it's an issue that needs to be talked about more, and awareness needs to happen more within the faith-based community, how they can respond and how we can respond being outside the faith-based community as well.
So final call for questions in the room or online. Okay, one question.
Hi. Have you found a lot of trafficking within social media? And I'm from Miami, Florida, and we do find that a lot of the children that we have are recruiting each other through Facebook, Instagram, and they're sending messages. We also see pimps recruiting girls. Are you also finding that same problem?
Absolutely.
Yes.
Vast majority of our kids are being posted on social media. Backpage is our biggest challenge right now.
Well, on Facebook, when you see your kid on Facebook, you don't think anything of it. And so the recruiting happening there are not sending out any red flags, where if your kid's on Backpage, that might send a red flag if you're educated, but if it's happening through Facebook or Kik or other sites that kids normally use, those red flags aren't going up.
And they're smart, so they use Snapchat because you really can't track that. So, I think it continues to evolve where we all used to think like, oh, it's Backpage, it's Craigslist, and now it's all these social media sites that, we have this challenge right on normalcy. Like, we don't want to turn Facebook off on our computers on site because it promotes relationships, hopefully healthy relationships. But we also know that it's a huge recruitment site, and so we just continue to have that, back to that safety conversation, those continued conversations about, what's an abnormal situation if you meet some guy on the internet and they tell you like 2 things about them, that's not necessarily like you should go meet them, tomorrow for a date, right? And we talk about what looks normal and what looks healthy and what doesn't. And so we've seen really an increase of a lot of safety trainings and internet trainings within, even within sex assault and domestic violence communities, really all promoting the risks of social media and helping educate our youth about that.
Well, as we close out this master session on human trafficking, we've heard from panelists numerous themes around coordination, collaboration, the importance of partnerships, balancing security with developing resiliency skills and normalcy, and addressing the short-term immediate impact of human trafficking along with the long-term health, socioeconomic connections to community and family. We've heard the importance of prevention and very early identification, the increasing engagement of survivors integrated into anti-trafficking programming and initiatives, working directly with young people to understand how prevention messages or intervention messages and tactics, strategies could resonate most with them. But there's also a lot that we didn't hear about during our short time today, whether it's addressing questions of how do rural communities respond to human trafficking when the resources are different from the types of resources represented in the cities on the panel today. What does human trafficking look like affecting American Indian, Alaska Native populations, and how do we engage tribal leaders and youth in those communities? We've touched on substance abuse and mental health issues, specifically for human trafficking victims, but it's a conversation that the country is having broadly as well of how do we address resources that aren't necessarily there in every single community, and but it's a universal and pressing need. How do we deal with safe housing placements? And so we hope that through this master session you have a clear illustration from our distinguished panelists here of how different professional sectors have worked together, but also how non-institutionalized services or community members, including educators, parents, youth, as peer mentors, and advocates as well, need to be engaged, there is a no wrong door approach, that survivors and victims of trafficking engage with potential sources of help from various systems of care and from family and other community resources. So I hope you gained a lot of new information and information particularly about resources from this master session. And with that, I just ask you to join me in thanking our distinguished panelists for this session as we close out. Thank you very much.